Assalamualaikum and hi everyone. Today our group will be presenting on Spirulina, which is one type of medicinal plant. So what is Spirulina? Spirulina is the general name of filamentous, multicellular, blue-green microalgae belonging to two genera, namely Spirulina and Arthospira, which consists of 50 species. The color of blue-green is due to the presence of phycocyanin that give its intense blue color. Spirulina plantasis is the most commonly available and widely used genus, which has been extensively studied in different fields, especially food industry and medicine. It thrives in elevated alkaline pH with a temperature optimum of 35 degrees Celsius. Spirulina consumption dates back at least to the reign of Aztec Emperor Montezuma between 1467 to 1520. Spirulina contains about 60% protein. Spirulina's lipid content is about 5% by weight and is rich in gamma-linolenic acid or GLA and linoleic acid or LA. Spirulina contains vitamins B1, which is thiamine, B2, which is riboflavin, B3, B6, B9, which is folic acid, as well as vitamins A and C. It is also a source of potassium, calcium, magnesium, zinc, and several other minerals and micronutrients. This amazing superfood also contains many pigments which may be beneficial as antioxidants, including zeaxanthin, phycocyanins, beta-carotene, and other carotenoids. Spirulina is now commercially available in powder and tablet form. It is traditionally used as food supplements in order to lose weight, used as an antioxidant, managing diabetes, and lowering the cholesterol. It was widely used in China, especially with medical aims, since it was used to increase desire and to prevent hair loss.
The study on the immunomodulatory agent spirulina has started since 1997 and did not stop until today with more accurate and precise data. It was started clinically studied before becoming one of the supplementary food chosen by NASA for their astronauts. Since then, more clinical trials are conducted to study the beneficial effect of spirulina. To explain more, here are two previous papers published regarding this plant-based supplement. According to a journal published by HHS Public Access and the Cardiovascular Therapy Journal, spirulina is proved to have hypolipidemic antioxidant and anti-inflammatory benefits. For the hypolipidemic action, preclinical trials were conducted by inducing hyperlipidemia in Wista rats by feeding them 68% fructose diet and then followed with administration of spirulina by 5%, 10%, and 15%. A significant reduction can be observed in hyperlipidemic profile, which proves spirulina increases lipoprotein lipase and hepatic triglyceride lipase activity. In human clinical trial, the target population were patients of type 2 diabetes mellitus, ischemic heart disease, nephrotic syndrome, and also healthy individuals. Some of the findings were type 2 diabetes mellitus patients who were administered with 2 grams spirulina for 2 months, and the results finding were significant reduction of triglyceride, total cholesterol, free fatty acids, LDL, VLDL, blood sugar, and glycated serum protein. In ischemic heart disease patients who were administered 2 grams spirulina for 2 months showed total plasma cholesterol, LDL, VLDL, triglyceride reduction by 22.4%. Antioxidant benefits were proved by the clinical trial conducted among 16 student volunteers with diet containing 5% spirulina for 3 weeks, and the results in significant reduction of plasma oxidative marker MDA with a simultaneous increase in the blood superoxide dismutase activity. Another clinical trial was conducted among 37 type 2 diabetes mellitus patients, which revealed that spirulina ingestion 8 grams daily for 12 weeks significantly reduced serum interleukin-6 and oxidative marker MAD levels. Anti-inflammatory benefits can be studied from preclinical trial conducted when complete ferns adjuvant and inflammatory inducer were introduced to mice, which results in adjuvant-induced arthritis in the paw that can be seen when there was significant increase in tissue marker lysosomal enzymes, glycoproteins, and the paw volume. This followed by 0.8 gram per kilogram of spirulina were administered daily for 8 days, and all alterations were almost completely normalized. Second study published by Otorhinolaryngologica Italica Journal on the clinical comparison of the efficacy of spirulina platensis and cetirizine for treatment of allergic rhinitis. The clinical trial were conducted on allergic rhinitis by performing randomized controlled clinical trial on 53 patients with allergic rhinitis, which divided into experimental and control groups. Subjects in the experimental group were treated with spirulina with 2 grams per day, and the control group was treated with cetirizine 10 milligrams per day for 2 months. The use of spirulina led to a significant decrease in the levels of interleukin alpha, interleukin beta, and interleukin 4, as well as significant increase in the level of interleukin 10, which is an anti-inflammatory cytokine. More studies supported the benefits of spirulina, but to name a few, here are some of them.
Spirulina product is one of the medicinal plant that can be commercialized and related to immunomodulatory activity. Nowadays, spirulina come in the form of pills, powder, capsule, tablet or liquid, which is important for health. It has been recognized and approved as a safe supplement by FDA. Development of various fortified foods made from spirulina has been commercialized to create nutritional awareness among people. It can help in immunomodulatory and antioxidant function. Next, immunomodulatory properties. Spirulina can increase the macrophages activity, stimulate the natural killer cells, and activation of T cells and B cells. Psychocyanin will release histamine from mast cells during an allergy inflammatory response, and it also can promote hematopoiesis, especially erythropoiesis, by inducing erythropoietin hormone, EPO, in order to maintain the sufficient oxygen delivered to tissue. Spirulina can enhance the reproduction of red blood cells and white blood cells by enhancing hematopoiesis.
Spirulina's early health benefits included its function in diabetes control and significant plasma triglyceride reduction effects, blood pressure reduction, anti-inflammatory effects, and antioxidant status enhancement. Spirulina activates cellular antioxidant enzymes, inhibits lipid peroxidation and DNA damage, scavenges free radicals, and increases the activity of superoxide dismutase and catalase. Phycocyanobulin, a phytochemical abundant in spirulina, inhibits NADPH oxidase activity and promotes glutathione synthesis, as well as a significant production of antioxidant enzymes, suggesting that it may be used to control oxidative stress in sickle cell disease. The iron chelative properties of spirulina was discovered when human neuroblastoma cells in vitro were exposed to toxic amounts of iron and then to spirulina, which revealed that the iron-induced oxidative stress was reduced. Spirulina supplements seem to affect more effectively the innate immunity, promoting the activity of natural killer cells. The effects on cytokines and lymphocytes proliferation depend on age, gender, and body weight differences. The nutritional value of spirulina is well recognized with its unusual high protein content and its richness in vitamins, minerals, essential fatty acids, and other nutrients. Spirulina was recommended to be one of the primary foods during the long-term space mission by both NASA and ESA due to its unusual high nutritional values. It is shown in Table 1 of 100 grams of spirulina. Table 2 shows some examples of spirulina's products in the market.
In conclusion, spirulina has been recommended as a good source of antioxidants, vitamins, minerals, as well as for its immunological and potential antiviral properties. Some studies associated with spirulina as food suggested that it is safe for consumption, especially in the form of supplementation, as it has been approved by the Food and Drug Administration (FDA). However, more clinical studies should be undertaken in order to prove that the intake of supplements containing spirulina has the benefits of immunomodulatory activity, which may boost the immunity level of the human body. That is all for our presentation today. Thank you.